Mansfield today on a Wednesday, and that means it's time to look at all the things that we don't want to look at sometimes, and that involve things in your body that are not lacquer, and things that doctors put in your body that are not lacquer, and it sometimes gets
embarrassing.
Yeah.
Shame.
That does, when, especially for men, I think.
And women.
Is it women as well?
Yeah, gee whiz. Of course.
I don't believe you.
It's true.
I think you
For all the women out there, it's true. They'll hit you.
Now, we wanted to talk about, no, I'm not wanting to, but Dr. Vicky Skitter, who is our resident GP, wants to talk about HPV. What is HPV?
HPV stands for human papillomavirus.
Right.
I'm sure most of the women that go for regular pap smears to the gynae will sort of recognize the HPV. It's basically the most common sexually transmitted disease that there is. 80% of sexually active people would be infected at some point in their lives. There's more than 100 types of different HPVs, and it affects different parts of the body. More than 30 types actually affects the genital area in males and females, including the rectum and anus. Of those 30, there's about 14 types considered high risk for leading to cervical cancer. We call it the oncogenic properties of the virus, causes cancer. Most HPV infections clear by themselves in about 6 months. There's sort of 10% that persists that can yield to cervical cancer in the long run. Well, that's the ones we worry about. In most of the infections, there's not really symptoms, so you don't know that you've got it. It can cause, obviously, genital warts. That's how we know that you've got it. From the outside, it can appear weeks or months or even years after the infection. It's this persistent infection that causes a 5 to 6 times higher risk of, or the risk is 5 to 6 times higher to get the persistent infection in those immunocompromised patients. So the HIV patients that's had transplants, autoimmune diseases, there's definitely a synergy between HPV and HIV. It makes them more prone to this persistent infection. So that's something that patients and doctors should be vigilant about.
How does HPV cause cervical cancer?
So certain types of strains of the HPV causes changes in the cells of the cervix. This is called dysplasia. If this goes untreated, it can advance to cervical cancer over time. It can take over 10 years to develop from dysplasia to atypical cells to cervical cancer or invasive cancer. However, if you've got HPV, it doesn't necessarily mean you're going to get dysplasia or cervical cancer. So, because it's quite a common infection, people mustn't panic. The HPV type 16, 18, and I think 31, those are the more oncogenic ones. So, you've got more risk for developing cervical cancer. And then it also obviously depends on what type you've got, what can happen. So this can be checked via DNA PCR testing at the same time when you have your pap smear.
How would you screen, or I'm trying to look for the word, test?
Test, yeah.
How would you test for cervical cancer changes?
So we all grew up with a pap smear.
I didn't.
Well, no, your mom did.
Ek het so waar, I got an account.
Yes, for a pap smear.
Saying, because I'm the senior member.
Main member.
and I got a letter from my
Medical aid.
medical aid saying, "Congratulations on having your pap smear.
Oh my
You've
gosh.
earned an extra 120 points."
I hope you kept those points.
Yeah, I kept.
So PAP actually comes from, it's a Dr. George Papanicolaou. He discovered the PAP test in 1928, which then was proven to be accurate, or the efficacy was proven in 1941. So we've been with the PAP smear, has been with us for over 80 years.
Yes.
That's a long time.
Yeah.
Your healthcare provider will use a small brush to remove some of the cells from the cervix, and then they look at those cells under the microscope. They look at any changes or abnormal cells or even infections. Doing a single pap smear in one's life is really going to miss a lot. You'll probably miss about 50% of those precancerous lesions if you only have one pap smear in your life. So it is a test that you need to repeat relatively often. Then if you've got abnormal cells, the next step would be to have a colposcopy. So you use an instrument called a colposcope. This shines a light and enlarges the view of the cervix. And then you paint a vinegar-like solution on the cervix, which then makes the abnormal cells go white so you can see where they are. And then you remove those cells. So then there's a third, more recent and probably more sensitive test, that's the HPV testing. So you basically look for the virus DNA in that sample of cells that you've taken in the pap smear. It can then also detect the type of HPV you've got, whether it's connected to possible cervical cancer in the future or not. And then obviously this is collected at the same time as a pap smear. So that's a very sensitive way of checking. Or the secondary prevention, or yeah, that's what we call it.
Can HIV can HPV be prevented?
Look, it can definitely be prevented. There's no medicinal cure for it, just to remember that. But we'll talk about that just now. But yes, it can be prevented. So obviously, it's through sexual contact that you can get this. So if you wear a condom, it can definitely reduce the risk for infection. Just remember, the condom doesn't cover the whole, all the skin of the genital area. So it's not 100% effective protecting you against this virus. Then we're looking at the HPV vaccine. And that's what I want to really mention. That vaccine gives extremely high protection to the types of HPV, which usually causes cervical cancer. It's probably the only way we could ever try and eradicate cervical cancer, which I think is quite a big thing, if you could do that. The best time to give the HPV vaccine would be in young school-going children from 9 on, but definitely before 15. So you want to try and catch them before they're sexually active. There's usually 3 doses. There's 1 dose, then 2 months later, and then 6 months later. So it's about 3 doses. In the Netherlands, I found that they've actually got self-sampling kits where through the postal system nogal, the patients will get a self-sampler. It looks like a tampon applicator. They would do the sample and they would actually post it back to the national screening program.
Jeez.
So if we could do that, that would be cool, but our postal system is not going to work, I think. Imagine all the pap smears lying at the postbox.
4 jaar oud is.
Exactly. That's not going to work. It would be cool, though, if we could do that. No. So asking about the treatment, you can obviously diagnose it and you can try and prevent it, but if you want to treat HPV, there's no medicinal cure for it. There's no medicine you can take to kill it off. But as I said, most of the HPVs go away by themselves, 70 to 90%. So if you then do get something like genital warts, that's quite a common thing. There's certain ways of getting rid of them. The gynae usually does that. So you can use cryosurgery, which is that freezing of the warts, lekker. Then you get something called LEEP. It's a loop electrosurgical excision. It's like a wire loop with electricity to sort of take it off. You're going to use local anesthetic, I'm sure. You get laser therapy, electrocautery, where you burn the warts with the electrical current. There's a prescription cream that the gynae sometimes prescribe. It's very important. If you've got a genital wart, don't go and get an over-the-counter wart cream and put it there, because there it's going to be a big problem. It's going to cause lots of issues. So rather go have the proper cream applied. Anyway, and then obviously if you've got abnormal cells on the cervix, you're going to do that colposcopy thing which we discussed. Can you feel the pain?
I can ek kan dit
Ja.
kan deur my hele liggaam voel.
Oh gosh.
Okay, how many men get affected by HPV?
So men can get infected, yes. They obviously don't run the risk of getting cervical cancer, obviously not. But but HPV can give genital warts on the penis, on the scrotum, in and around the anus. So that's not very nice, and that's obviously how it gets transferred to the females. It has also been linked to uncommon cancers like penile cancers, anal cancer, and head and neck cancers. So remember that. If we are looking to try and get herd immunity, that will be obviously first prize, because then we can actually try and get to eradicating cervical cancer one day. It's obviously important to have a gender-neutral vaccination program. So it's not just girls. It should be the boys as well. So, men can actually help women in preventing cervical cancer by having the HPV vaccine. So if there's a take-home message for HPV vaccine or HPV and cervical cancers is to the woman, please make sure that you go for regular pap smears and ask your GP or your gynae. And they usually do it now anyway, but just double check that they're actually checking for HPV. And then to the mothers out there is try and vaccinate your children, please, boys and girls, not just the girls, before the age of 15.
And that is
It's a normal, like the flu shot, you know?
Yeah, okay.
Yeah.